Hey, welcome to the podcast. My name is Nico. Some people call me Nick. I am the Senior Program Coordinator here at the Avante Ibogaine Institute in Nassau, Bahamas. It's a beautiful Caribbean morning here. Thanks for joining us. This is Ibogaine Unfiltered, and this is a weekly podcast that we're doing to educate and inform people on the benefits of clinical Ibogaine treatment. Also, to dispel the rumor, the innuendo, embellishments, and frankly, sometimes flat out lies that are told about Ibogaine treatment. We want to candidly, transparently talk about clinical Ibogaine treatment, if it can help you or a loved one or not. If they're a candidate or not, and we're gonna explain all those things honestly and transparently. Each week, we are going to select a topic, and it's typically going to feature or focus on a drug, a specific drug, or addiction of some type, whether it's alcohol, ethanol, or and including PTSD and depression, general anxiety disorder, all of the things that the categories where Ibogaine treatment has been found to be beneficial to people. So today, I want to talk about fentanyl. Fentanyl, and awful drug, just an awful drug. And for those of you who are out there watching who are challenged by an addiction to fentanyl, um, man, I know your pain, and I there's a way out. I can promise you that. That's what I can say to you today, is that I'm 16 years in recovery. A lot of our supportive staff here, not our clinicians or our physician, but our supportive staff are in recovery themselves. I can tell you that there's a way out, and I promise you that. And not only that, but the other side is it's a beautiful life. It's a beautiful life. The guilt, the shame, all that, it dissipates. I promise you that. So it does require commitment. It does require, mental fortitude and just a commitment to do anything and everything necessary to end it, the addiction. But you will succeed if you put your mind to it. And Ibogaine treatment very likely can help you. We're going to talk about that today. So fentanyl, what is it? What are the effects of fentanyl? How is fentanyl dosed? What are the dangers of fentanyl? So many obvious dangers. And then how Ibogaine treatment, how clinical Ibogaine treatment can help you overcome your physical and emotional addiction to fentanyl. So, what is fentanyl? My cheat sheets. I want to get this right. Fentanyl is a potent synthetic opioid drug used primarily for pain relief and as an anesthetic. It's approximately 100 times more potent than morphine and 50 times more potent than heroin. 50 times more potent than heroin. This class of drugs, known as opioids, are the deadliest type of drug known to man. At least one type of opioid is a factor in over 70% of the overdose deaths in America. And fentanyl by far leads this category, killing more than 3 times any other type of chemical substance overdose. Over the past 5 to 7 years, really, fentanyl has become prominent in the illicit drug trade and is used as an alternative to heroin. Factually, as anyone who's has an issue with fentanyl knows, it's hard to find heroin that doesn't contain fentanyl anymore. And because it's so powerful, drug dealers and traffickers and manufacturers are putting it in the heroin. So they'll get the clean heroin and then they'll add the fentanyl to it, irregardless of who they kill or whose life they destroy. So that's a topic for another day, but it's a disgusting thing. So fentanyl is extraordinarily addictive, extraordinarily, and so for those of you who, family members, parents who don't really understand the depths of fentanyl addiction, as an ex-opioid addict, OxyContin, not fentanyl, but probably would have been had it been around back 20 years ago. But I can tell you that there's no worse drug that brings you to your knees, physically brings you to your knees, than opioids. Strong opioids, like, well, really any opioid, but any addiction, but fentanyl, these class of fentanyl, heroin, OxyContin, and these pharmaceutical synthetics, just terrible things to get addicted to, because it's not a mind over matter thing. It's not just pull your bootstraps up, get determined. No, this is a physical. It brings you to your knees. I mean, the illness. I tell parents often and family members, imagine having the worst flu of your life. Just go back to that time when you had the worst flu of your life, and then layer on it a shellfish poisoning, or like a food poisoning. So, and then wallow in that for a week or so, or 10 days. I mean, that's how painful this addiction can be, and the detox from it can be. The acute withdrawals, they're awful. They're awful. So, and that's one of the biggest fears, right, for most people trying to get off of fentanyl, is they don't want to suffer. They just don't want to suffer. They could just take another small hit of that of it, and all those symptoms go away. The nausea, the crampiness, the cold sweats, the chills, the watery eyes, runny nose, diarrhea, in some cases vomiting, just the overall sense, the depression. The depression is just, like I said previously, and it's just opioid depression is the darkest cloud. It's awful. So yeah, we all have compassion for individuals who are battling addiction, but when it comes to certain stages of addiction and certain drugs, man, willpower is out the window. It's really truly about systematically formulating a plan of action, and with medical support, and in our case, not only medical support, but holistic, natural medicine support, and systematically attacking the addiction one day at a time. And we can do that here at the Avante Institute. Now, how is fentanyl dosed? Similar to heroin. IV injection is the most prominent method. We see that probably in 75% of patients here at the Avante Institute. But long-term use can collapse the veins, send them down deep, and so smoking the fentanyl, and also inhaling it, so snorting it. Those are the three primary methods. I'm sure there's other methods, far less common, but when there's a will, there's a way. When we need the fix, uh, we'll find a way to get it. We have to. It's just either that, or not only do you get deathly ill, but it's that sense of your world collapsing, even though your world is in shambles at the time. Yeah, so that's how it's dosed. The dangers of fentanyl, I mean, other than the very, very obvious, right? I mean, we've lost so many beautiful young people to fentanyl. Um, it's just horrifying. And the respiratory depression is extremely dangerous. Um, highly encourage anyone who's actively using. Not, I mean, it's a crazy to suggest this because you have to use when you have to use, but it's so dangerous to use alone without someone there to Narcan you. Um, yeah, so the dangers. Respiratory depression is the biggest ones. It's extreme potency. It's deadly to anyone who unsuspectedly comes in contact with fentanyl. As little as someone who has never touched the drug before, as little as 5 to 10 specks of salt, table salt worth of fentanyl could can kill someone. That's why when you see these drug seizures on television, the cops are all masked up and they've got their gloves on and what have you, because it looks like they're in a hazmat, situation, because it is that dangerous. So you must carefully dose. Those who are actively using know very well how dangerous it is and how they have to be very specific in their dosage. And not only that, but every single time that they source their dope, you don't know what you're getting that time. You just don't. um, we have clients come here who say, oh, I test my fentanyl. Well, how do you do that? Well, I go and I buy a drug test kit, and then I'll put it in water and put it in there to see if there's fentanyl in it. And it comes up negative. Well, first of all, those drug test kits, you have to get a very specific one for fentanyl. And they don't generally come in the 12 or 18 panel drug screens. They may in some, but we use a very specific one here at Avante for our tests. So how does Ibogaine treatment work to treat fentanyl addiction? Ibogaine works in the brain to rapidly rebalance it neurochemically. That's number one. Because they've been introducing external chemicals into their body for so long, the body shuts down its natural production of endorphins, the natural feel-good chemicals that we need. So that's serotonin and dopamine, and there's some others, but predominantly serotonin. Ibogaine has a way to jumpstart the body's natural production of these essential feel-good chemicals. So there's not that lag time that can be 3, 4, 6 months before the body is fully rebalanced naturally. Ibogaine springboards it ahead, and literally within, following one treatment, maybe one treatment and some booster doses, a client is back to a balanced state of emotional well-being neurochemically. And that's probably Ibogaine works in a lot of amazing ways, but that's key. That's key right there. That's what sets Ibogaine apart from traditional detox, is that lag time, because we all know the term dry drunk, right? So we go through a 5 or 10 day detox, don't have a drop of liquor, of booze, and then come out the other side, and everyone's happy for you and proud and excited about and hopeful. But we know inside that the cravings are there, the monkey's on our back, the can't go by a liquor store or by a bar without thinking, oh, you know, if I could only just go in there and have a pop. So the point is, Ibogaine eliminates that. It quashes the cravings. I mean, it just annihilates cravings. It removes that monkey from your back. And that's done through this, what they call neuroplasticity, this effect of neuroplasticity, this cellular reconnection in the brain that rebalances neurochemical levels and makes you feel. We have clients that float out of here on a pink cloud, on a pink cloud. Not everyone, but many, many. And that is one of the biggest benefits of clinical Ibogaine treatment for fentanyl addiction. So in addition to this action of neuroplasticity, Ibogaine also works on the opioid receptor sites, is what results in the removal of withdrawal symptoms, post-acute withdrawal. So between breaking of this emotional through the neuroplasticity, through breaking of the emotional cycle of withdrawal, and the physical, the post-acute withdrawals, removal of the physical withdrawal symptoms, this is how Ibogaine springboards people, call it 3 to 4 months ahead of a traditional detox protocol. You know, what is this? What happens through this process? It develops a tremendous sense of confidence for the individual. So our patients leave feeling restored, renewed, rebalanced, and they're able to put their addiction in the rear view and focus, you know, on their recovery. And this is what is the big difference between clinical Ibogaine treatment and traditional detox methods, and why people are able to achieve, a much higher percentage of people are able to achieve sustainable long-term recovery through Ibogaine treatment. I mean, these are key factors. This is, and granted, most of it's anecdotal evidence, right? I've seen it with my eyes. Other clinicians, other providers see it with their eyes. That's why we're so excited about the programs. But you know, it's worth researching and investigating and determining if it's a right fit for your loved one or for you. We're very proud that we've helped to guide over the past 12 years, literally over 1,000 clients through recovery. And frankly, some of them were very bad, in very bad condition. Others not so much, but they were flirting with something that really could have gotten out of control. And they recognized it, and because that's something about fentanyl too, and is that it bites you. I mean, it gets you. It's not something that you can just, you know, play around with. It's going to get a hold of anyone who messes with it. After using for a period of time, it's almost as if the reverse happens. You know, that's that opioid syndrome where, you know, they take it for pain relief, and then, you know, 3 months later, boy, you feel every aching pain in your body and multiplied. And then, you know, they take it for anxiety relief, and then they just 3 months down the road, I mean, the anxiety is off the charts. So It doesn't work. Uh, it masquerades as something that will uh, maybe get you out of a situation or a feeling or that you're in. But it's flirting with the devil. It's flirting with a terribly poisonous and dangerous drug. I compel anyone who's within earshot of this, please, to take it very seriously. Avoid fentanyl by every every means. Educate your children, tell them about it, don't be shy about it. um, these are things that need to be talked about. So thanks again for watching. I'm Nico, or Nick, with the Avante Ibogaine Institute in Nassau, Bahamas. This has been Ibogaine Unfiltered, and please send us your questions. If there's anything we didn't cover today, which I'm sure there's a lot, just email us the questions, and we will answer them as completely and transparently as we can for you. And then we can feature them on the next episode so that we can share them with others. That's the way we can find out what it is that the information you're looking for. But thanks again for watching. Next episode, next week, we will be talking about alcoholism, how clinical Ibogaine treatment can help with alcoholism. So have a great day. Thanks for watching.